Welcome, everyone. Welcome. Welcome, everyone, to our ninth session of this how-to series. It's going to be a pleasure to discuss this important topic today on how to write a climate and health paper for publication. And as many of you know, this is a series of sessions on how to and to provide to equipping health professionals with hands-on techniques, leadership strategies, and teaching tools for promoting climate action in different settings. So this is our last session on this series, and if you were interested to watch the previous session, you can find all of them in our GCCHE YouTube channel. Today, we have the learning objectives to know how to structure and communicate climate and health research to meet academic standards while engaging diverse audience, including policymakers and practitioners, and also to identify strategy to align research topics with current climate, health, and policy priorities to enhance relevancy and potential for publication. We will also try to gain practical insights into publishing process, including selection of appropriate journals, tailoring submission, and increasing the impact and visibility of your work. If you are from the Caribbean region and if you are interested to have a CME, you can fill up the survey that will be included at the end of the session in the chat. So before we start the session, I would like to propose a poll question so we can have an idea about your experience on publishing on climate and health. So what is your level of experience publishing on climate and health? I have not yet published. I have been co-author in 1 or 2 publications. I have been a lead author or co-author in more than 3 publications. Great. So I think this is very important for our presenters. And most of you said that you have not published yet on climate and health. So I think this session is going to be very useful for all of you and also for the ones that already publish because we are always learning on how to do that. And today we have these amazing presenters. We will start with Dr. Duhaime, who is a senior pediatric neurosurgeon at Massachusetts General Hospital, and the Nicholas T. Zervas, distinguished professor of neurosurgery at the Harvard Medical School. Her research focuses on traumatic brain injury in children and the links between brain, behavior, and environmental issues. A former Harvard Radcliffe Fellow, she explored how brain reward systems related to pro-environmental behavior work featured in her 2022 book, Minding the Climate, which won the 2023 Project Syndicate Sustainability Book Award. She's also an associate director of the MG8 Center for Environmental and Health and associate editor-in-chief of the Journal of Climate Change and Health. So, Dr. Duhaime, the floor is yours. Thank you so much for being here and accepting our invitation.
Terrific. Thank you. And welcome, everybody. And I'm going to share my screen. Let's make sure that works. All right. Does that look correct to those that can see it?
Yes, perfect.
All right,
Thank you.
Okay, good. Well, what a wonderful audience from all over the world. It's been great fun to look in the chat and see where everybody's from. And like many of you, when I started, I hadn't published and really didn't know where to begin. And so I hope that this part of the talk, which will be the most basic, and then my colleagues will get more advanced, is just going to be the basics. Why publish? What should you publish, and where should you publish it? So it's going to be very elementary, and those of you who have already done this may find it redundant. So you can have a coffee break now and listen to the more advanced parts later in the talk. So let's start with why publish a paper. A lot of times people say, I don't have anything to share, but I want to stress something that everyone here knows. Climate change and health, it's a really important topic. It's going to be increasingly important. It's important now, and it's only going to get more so. So any insights that your observations help others understand is going to be of value. One thing people don't recognize is that just by setting the goal of publication, when you are starting to do this kind of work and you're looking at how can I collect information? What observations are there? If you're thinking about publishing as you start to do your work, or while you're doing your work, and you have that goal of publishing, it will improve the quality of your work because you'll have to do it at a higher level in order to have sufficient data to get published. One really good thing about publishing is that your work connects you to other people. And at the bottom of this slide, I show my hospital, Massachusetts General Hospital in Boston, USA, and one of the large children's hospitals in the western part of Ukraine. And because I have published and because I have gotten to know people in other places through things that we work on together, I'm connected now to neonatologists in Ukraine who are working in a war zone and in a place that's affected by that intersection of war and climate change. And without publishing, I wouldn't have had that opportunity. So it connects you to other people that are interested in some of the same things, and you can collaborate with them and expand your own reach that way. And publishing increases your impact. It's one thing to teach your colleagues, to teach your students and your trainees, maybe to teach your local officials, your people in your healthcare center. But publishing gets you a global impact, and this can really improve the reach of what you're able to do. So the next question is, what should you publish? And there are many levels of things that you can publish. One is the observations at the place that you work, the work that you're doing, just things that you've seen. You can describe them. You can share them with other people who may have similar experiences or notice that you're seeing something different than what they're seeing. Either of those can be valuable. Sometimes there are topics where you notice something, but you want to know what else there is out there. And you decide that you need to review it for your own purposes, for healthcare delivery, or because your health system is doing something different, and you want to review what other people are doing. And so you recognize that you need to do something, and that review can be shared with others. So that's another reason of content for what you might want to publish. Sometimes you've had the opportunity to collect data more systematically. This could be clinical data on patients that you treat. This could be hospital data or health system data or public health data. But you've collected it, and now it's time to put it in order and be able to share it. And sometimes you've done studies to answer a very specific question. What's the best way? What's the most effective way? What's the most impactful way? And you've tested one way against another way, and you've actually collected data to try to answer a very specific question that's relevant to the profession that you are in. And then that's actually a study, and that's worth studying. So what should you publish? Sometimes you don't know where to start, and you make your decision based on who's asking for information in this particular area. So as was mentioned by Daniele, I am the Associate Editor-in-Chief of the Journal of Climate Change and Health. There are many different journals that publish articles in this area, but I know mine the best. So I'm just pointing out here with the red arrow that from time to time there are calls for papers on specific topics. So in the journals that you might learn to be interested in through this collection of talks today, you can check. This happens to be on the website, and right now there are calls for papers in different topics. So if you're not sure where to begin, you can look and see if there's some place that wants articles specifically in the area that you are working in. Now, of course, there are different types of publications. There are peer-reviewed journal articles. There are white papers that might be written for a government or a health agency or even a professional organization. Of course, there are blogs, and there are many other places that you can publish things: letters to the editor, editorials, commentaries, lay publications for other physicians or health workers, or lay publications for the general public. And then there are media posts. What I'm going to focus on primarily is the peer-reviewed journal articles, because that's the one that I know the most about, and that's what most people in anything having to do with academics, teaching, or research prefer to publish in. Now, within the peer-reviewed universe, there are many different types of articles, and each has a different format. And again, I'm focusing on the Journal of Climate Change and Health just as examples, because I know no one's going to get mad at me for putting pages from the journal and having copyright rules here, because this is all open access. But I put arrows where you find what type of article it is in our journal. It's right at the top. So you can see that the top one is a research article. The next one is something called short communication. And the one below that is called a case report. And each of these has different structures, has different content, has different organization, and really is designed to communicate different kinds of information. So there can be reviews, as we mentioned. We happen to, in our journal, have two types of short communication. One is for research, short communications, preliminary data, pilot studies. And the other kind of short communication focuses on emerging issues. So this may be things you've observed in your work that you notice for the first time. There's a new incidence of something, or there's a new type of disease, or there's a new type of health issue that you're seeing in your area for the first time. And that would fall under the category of short communications, because it's not fully developed yet. It's new, it's preliminary, but it's an emerging issue. There are case reports and series. Sometimes you just have observed a short list of similar things that you want to pull together into a report. And then we also have a category called perspectives, which are longer reports for experts. So I think my colleagues are going to talk about this in more detail, but I'm going to just talk about the basics. How do you decide for peer-reviewed work what journal that you might want to aim for? So it's pretty simple. You search for other articles on the topic that you're interested in and see where they're published. So you can just do a simple search engine search on your topic, and you can find out where those things have been published. And then you can go look them out. And you can, if you find, for example, it's a journal, you can go, virtually all the journals have websites, and you can look at what they publish, look at what article types they have, what kind of sample sizes, what data, what kind of statistics, what kind of geographic sources their papers tend to come from, and you can see what kind of a match. A lot of times it's helpful to ask a colleague for advice and just say, where do you think I could send a paper on this topic? Particularly those that are more experienced in publishing. Occasionally, I know at my journal, and I've been on the editorial board of several different journals, some in my subspecialty of surgery, but others having to do with general surgery, trauma, climate change, and so forth. And sometimes we'll get a letter saying, we wrote this article, would this be of interest to you? I will say that sometimes you get a firm answer, yes or no, but more often they'll say, if you're interested, submit it, and here's the type of paper it looks like it is. But a lot of times that will not give you a firm answer about whether the paper would be relevant for that journal. So once you do that, how do you decide what article type? Now, at the top, I put the website to the Guide for Authors in our journal. And the Guide for Authors is online, and it has every bit of information you could want. What is this journal looking for? What are the different article types? What does the peer review process involve? What are the charges? Because open access journals oftentimes have a charge that goes with publishing. However, there is free publishing for selected lower and middle income countries. So don't let that stop you without checking it out, because sometimes for the region that you are in, the publication fee is waived. And I put an arrow here from article types because, for example, in our journal, and I think in most journals, they tell you exactly what to do. How long should the paper be? How should it be formatted? What about references? What format should the reference be in? All of that is laid out on the website for most journals. So let's get even more basic. How do you learn how to write a paper? So you have all these instructions, but where do you begin? So it's pretty simple. Look through journals on your topic and read some of those papers. And then what I tell my trainees that are starting in this is decide what journal and article type fit seems to be the best so that you can know where to begin. But then I tell them to meet with your colleagues that are working with you on this. Usually it's not an independent thing that you do by yourself, but you work with your colleagues, and pick a title. What would you like your article to say? What information do you have to share? And once you have your title, which can be a very rough draft, you can change it later, but that gives you the focus of where you're starting. So it might be something like, increased incidence of malaria in school children in, District X. Like, what is it? What's the nugget? What's the kernel of information that you're trying to share? And sometimes I believe that starting with that title gives you the rest of, that's your entry port. Then make an outline, follow the format of the type of article that your journal that you're aiming for requires. Distribute, I find it easier to not take it all on myself, and I distribute the sections to my colleagues. So somebody might take the introduction, somebody might take the methods, somebody, if it's a research paper or a short communication, for example, in my journal that has short communication for research, which is pilot studies, and those can be descriptive, or if it's a case report, distribute the various sections so that each person takes on something, and then you can all edit it, but it makes it more doable. It's a little bit less overwhelming that way. Then once your manuscript is assembled, everybody reviews it internally, and then you get to be ready to submit. And recognize that you almost never get accepted on the first pass, and I think another of my colleagues will talk more about this. You have to resubmit, and honestly, I have worked with authors, groups of authors who are new at this, and we've had them do 10 or 11 or 12 revisions. But we really want them to publish their work. And so we'll work with them over and over again to fine tune it and bring it to a level that the reader can understand it well. Another way to learn how to write a paper is to volunteer to be a reviewer. All journals need reviewers. So if you want to be a reviewer, there are detailed instructions about how you do it, what you look for, how it's done, the mechanics of it on most journals' websites, and all journals will welcome you as a reviewer. You can check the website or the portal of the journal you're interested in, or you can mail the journal editor-in-chief for instructions. There's lots of guidance, and that way you get to read a bunch of papers and be critical, and you see what other people say about the paper that you're reviewing, and you learn a lot about how to write a paper from reviewing papers. So what are editors looking for? Editors are looking for a high quality paper in which the readership will be interested, because the number of readers that click on that link and the number of other authors that cite that paper, that improves the journal's standing. And it's also good if it's something juicy, it gets picked up by the press or by a blogger or by social media because it's a new and interesting finding or observation. And the findings, if the findings are going to make a difference in policy, in medical care, so anything that's current, important, novel, or changes something. In the bottom is a slide of our recent editorial board meeting. I hope I don't give anybody's identity away here, but we're looking at metrics. We want people to read our journal. We want people to cite the paper. So that's what the editors are looking for. The reviewers, on the other hand, they're looking for readability, for clarity, for a rationale for the study or a hypothesis being clearly defined. Whatever methods you use are described succinctly, thoroughly, they're appropriate, they're unbiased, you can justify them. The results are clear and succinct. The discussion is short, but it puts the findings in context. The references that you cite are appropriate, they're targeted, it's the right number. You don't put in 300 references just to show everything you know, but the references are the ones that the reader needs. The conclusions arise from whatever the data are that you've presented, and that the authors, this is a big one for reviewers and editors, the authors haven't followed the instructions that are in the journal's website about how you construct your paper. So what resources do you need? The main one for everything is curiosity. You should actually be interested in, what is this topic? What has caught your attention? If it's caught your attention, it's relevant to others. You should have discernment so that you have the ability to recognize when something is valuable to share. You have to have persistence, and I know another person will be talking about that. You really need access to the internet, and you need access to a library. It can be totally online, or it can be an in-person library. And you need access to a proofreader who is fluent in whatever language that your journal accepts. What else is helpful? Colleagues with different skills. So somebody who is good at organization and data management, someone who's got good attention to detail, somebody who's a big picture thinker. How is this important and relevant? And you need people who say, they're skeptical, and you need people who are really optimistic. So having a variety of people in the team that you're working with is very, very useful for publication because they bring different skills. Remember that whatever it is that you're experiencing in climate and health, it's unique. Nobody else has your experience. What you observe is worth sharing with others. Others will benefit from learning from what you have seen and what you're experiencing. Climate change is going to get worse no matter what we do. We hope it'll get less worse than the worst worse, but it will accelerate, and health effects will increase in importance. So whatever you're observing is very, very important and valuable to share. We need to have a vision for what future we're working towards and how to get there together successfully and safely. So I just want to emphasize that there's a lot of people interested in what it is that you're seeing. And I hope that through these talks, you can have the opportunity to share them with others. So I'll stop there and we'll move to the next speaker.
Thank you so much. Thank you so much, Dr. Duhaime. It was a very comprehensive introduction, and it looks very simple, but we know that it's a lot of steps, but when you start to do it, you kind of like it, and we kind of get addictive of publishing and share our knowledge with the audience because it's needed. So I'm going to call the next presenter, Loren de Freitas. Let me introduce Loren. Is a lecturer in public health at the University of West Indies. She's also an associate member at the Earth Medic, Earth Nurse. She has a whole roles in academic publishing as clinical editor in the education section of the British Medical Journal, and the outgoing chief editor of the Caribbean Medical Journal. So over to you, Loren. Thank you.
Great, thank you, Daniele, for that. I'm just going to share as well. All right, can you see it? Can you see the screen?
Yes.
Yep. Okay, great. So good afternoon, everyone. Thanks for the opportunity to be here today to talk about getting published. My presentation is more going to focus on some of the practical tips and key points that might help us get our work published, specifically in a scientific journal. My presentation is not specific to climate and health. The points are applicable to multiple fields. And it's also informed by two perspectives: my role as a researcher and somebody who submits the journals and has that experience, as well as an editor. So Tina talked in the beginning about why you should get published, but you might also be wondering, how do you even get involved in research in the first place? And Tina touched a little bit on this, talking about networking and talking to your colleagues. So one of the first ways is just simply being proactive. In your working environment, you can ask around, see what other people are doing, see who's already doing research, get some ideas or feedback from them. Or if you're aware of a specific researcher who you think does great research, it's an area that you're interested in, you can shoot them an email. Chances are they're going to respond and tell you something. Generally, you should try to pick an area that you do have an interest in. So we're all here talking about climate and health. So that's your area of interest, because that's what's going to keep you motivated and going when things get tough. Research is not meant to be done by yourself, so collaboration is key. Another way is really just to align yourself with somebody who is already doing a research project. If it's in an area of your interest, you can ask to be involved. Or if they have an upcoming project, can you join them? There's usually some work to do, and people are always happy to have extra hands. And of course, you can develop, and you should develop your own ideas. But if you're new to it, then approach somebody who's more senior, has that experience, who's willing to help you develop it further. So you might also be wondering, okay, I have an idea about how to start. I know I want to get published. How do I actually start with identifying an article to get published? So as you saw in Tina's presentation, journals have lots of different article types that you can choose. So one really simple way to start is starting with a case report. This is mostly if you're in a clinical setting. You have a case of patient that you have seen. Usually case reports are something unusual or rare, but these tend to be fairly simple and straightforward to write up. Some journals also have teaching cases, which tend to be more common clinical topics. So if we're talking about climate and health, it could be a case on heat illness or case on air pollution. Then you can move into viewpoints and editorials, which are not core research, but it's a really nice way if you're new to the publishing environment to get work published and to get familiar with the process. And in terms of actual original research, starting with surveys, cross-sectional study designs is also a nice entry point. Then the next question you might ask yourself is, where can I publish? And we're specifically talking about where can we publish in this Caribbean region. So we do have a few health-related journals. You're seeing them on the slide, the Pan American Journal of Public Health, which is produced by the Pan American Health Organization, West Indian Medical Journal, produced by the University of the West Indies, the Caribbean Medical Journal, produced by the Trinidad and Tobago Medical Association, and then the Lancet Regional Health of the Americas, which is part of the Lancet Group. These journals vary in the size, the volume, the number of articles that they produce. They vary with respect to whether they have article processing fees, whether they are open access or not. So it does give you quite a few options within the region for you to publish health-related work. We know that with climate and health, not all of the work is published in a core health journal. A lot of the work might be found in non-health journals. So I've identified a few that also exist in the region. The first three are produced by the University of the West Indies, Engineering, Vet, and Law. We also have Journal of Caribbean Environmental Sciences and Renewable Energy, and the Caribbean Journal of Sciences and Technology. So we do have a few options within the region for our regional researchers to publish. So although we're talking about publications, it's still good to talk about how else you can share your work. So you may be familiar with conferences, doing a poster presentation or oral presentation. The Caribbean Public Health Agency has their annual conference, which is probably the largest one in the region. Trinidad and Tobago has a National Health Research Conference, and then the different health professional associations in the Caribbean also put on conferences. So those are some options. But really want to talk about the preprint servers, as this is a very popular way for researchers to get their work out quickly. So preprint servers are online platforms that allow you to upload your manuscript. This is not an abstract, it's not a poster presentation. This is your full manuscript that is uploaded onto the platform. And once it is approved, it is accessible to anyone who is interested. There is no peer review process here. That is one of the main things to know about it. But what those platforms allow is for people who are reading your article to still give you feedback, so that when you are preparing to submit your article to a scientific journal, you can utilize their feedback to improve your manuscript before submission. These preprint servers are quite popular now, so much so that several journals have incorporated it into their submission process, meaning that when you submit to a journal, one of the questions that they might ask you in the submission process is if you want them, the journal, to upload your manuscript to a preprint server so that your work is published, it's accessible to people while it's going through the submission and publication process. So Tina talks a little bit about this, about how to choose a journal, and I'm going to talk about it as well, but looking at some different points. One of the factors that you should consider is your audience. Who are you writing for? Who's your primary audience? Who do you want to be the one reading your article? Then you have to consider whether that audience can actually access your work based on your chosen journal. Because remember, some of the journals, they have a fee, it's behind a paywall, and even if you get it published, it doesn't mean that your audience will be able to access it unless it is open access. You might also want to consider who's your unintended audience. So you have your primary or your core audience, but there may be other people who would find value in your work, and you want to think about them as well, and whether they have access to your chosen journal or are aware of your chosen journal, and how you might bring that journal and your work to their attention. You definitely want to consider whether your research is going to match the scope of that journal. If it doesn't, it increases your chances of being rejected. When you are trying to choose a journal, it's probably a good idea to make a list of maybe 5 journals that you want, that you think would be a good fit for your research, so that if for some reason you're unsuccessful with the first one, you just move on to your next on the list, and you keep going until you get one that accepts you. Lastly, I just want to talk about something called the impact factor. You may be familiar with this term. The impact factor is a metric that some journals use. It's sort of a way to measure the quality of that journal. And the impact factor represents the frequency with which an average article in the journal has been cited by someone else over a particular period of time. So the higher the impact factor of a journal is, the better that journal is thought to be. High impact factor journals often come with high publication or article processing fees. However, if you are in the academic world, if you're in a university, if you're a student, you're trying to apply for a residency program or a job, and your potential organization looks at your publication list, they may be interested in whether you have published in high impact factor journals. And so it puts a lot of pressure on researchers to try to publish in these types of journals. However, it is important to acknowledge and know that journals that have lower impact factors or journals that do not have an impact factor at all are still relevant. And you should not let the impact factor be the deciding factor. It can influence you, but it shouldn't be the deciding factor about whether you are going to submit to a particular journal or not. Because you want to think about other factors that we've talked about, and who's going to read your article, and whether they're going to have access to it based on the journal that you have chosen. Okay, so we're going to move into some more practical tips, things that you should be aware of when you are preparing your manuscript and getting ready for submission. So one of the first things that you should be aware of and familiarize yourself with are the authorship criteria. So the International Committee of Medical Journal Editors has produced and published authorship criteria, and the vast majority of journals will use these criteria. It's going to be published on the journal website. If not, you just go to the ICMJE website and you will find detailed information about the criteria, and you definitely want to familiarize yourself with it. Discussions related to authorship should not take place when you are getting ready to submit. They need to take place as early as possible, usually in the planning stages of your research project. At least start thinking about it. Who's going to be part of my research team? How are they going to contribute? Who could potentially be an author? Because journals will ask you to list each individual person's contributions to the article. And most of the time, this is going to be aligned with the criteria. Authorship is not determined by the journal. It's determined by the research team. So if there are disputes, queries, or concerns, journals follow particular guidance, and they're going to send it right back to you to work it out. Sometimes they'll go to your institution, depending on the particular issue. So you want to save yourself some trouble at the end and some awkward conversations at the end by having these conversations about authorship early on in the process. Along those same lines, we really should also be aware of equity in authorship. So you may be familiar with these terms, parachute or helicopter research. This is generally when some external research or external organization, typically from a higher resource setting, comes to do research in a lower resource setting, and they involve the local team, but maybe the involvement is not as significant as it should be. Or maybe it is a significant involvement, but when you are writing up the manuscript, the local team is not included in the author list. And so there's a big drive now to promote equitable authorship, particularly when there are collaborations between those from a higher resource setting and a lower resource setting. And that could happen even within a country, where you just have an organization with more resources coming to do research in a community with less resources. So this topic was so important that a group of editors and researchers, they wrote an article a couple of years ago, and they came up with 6 recommendations to help promote equity in authorship. So I'm not going to go through all of them. You can see the ones that I've bolded. In particular, the second one, where stating that there's an expectation, where there is that collaboration, then they want to see the author from the lower resource setting either as first author or last author, because in most research fields, first and last are the important authorship positions. And then they're also asking for researchers to submit what they've termed a reflexivity statement, which is a structured statement describing the ways in which equity was promoted throughout the research process. Now, these recommendations are just that, recommendations. It is not mandatory, and not all journals have adopted them. It's mainly global health journals that have adopted this. Even if your journal has not adopted it, it has not asked you for the reflexivity statement, it's still useful for you as a researcher to be familiar with this, because it can help you to start conversations with your international teams, your collaborators, your fellow researchers, with respect to authorship and ensuring equity. This authorship, the second key point has to do with ethics. Now, there are quite a few ethical issues that come across with publications. I'm just going to highlight two. One has to do with plagiarism. This tends to be common, particularly amongst researchers who are new, who are not accustomed to writing a manuscript, so you're less familiar. Oftentimes, what you'll see happening is that somebody will copy and paste a paragraph from another source, they'll put the citation at the end, and they think that's okay, I've not plagiarized. But in fact, that is a form of plagiarism, and really you should be rewriting that paragraph in your own words, still including the citation. Most journals have plagiarism detection software, so they do run the manuscript through the software, which will highlight any areas of plagiarism, and then the editors will go through and decide if this is something that we need to be wary of or not. Another point has to do with getting ethical approval for your research. So things like your viewpoints and your editorials do not require ethical approval, but anything that is considered research should really be submitted to an ethics committee. You cannot wait until you are ready to submit to then think about ethical approval. By then, it's probably going to be too late, because the vast majority of ethics committees will not issue ethical approval retrospectively. So you need to sort out your ethics in the planning phase. It is not enough to say that you follow the Helsinki guidelines with respect to doing research on human subjects, because that is the minimum standard. All research requires a statement from an ethics committee. And that statement might simply be that your project was exempt from a full review. And that's fine. But at least you would have sent it through, and the ethics committee would have made that decision for you. Okay, so we're on to the last stage of the presentation, and we're looking at what happens when we submit. So what we should do before we submit and what we should do after. So Tina talked about this, reading the instructions to authors. All journals should have this on their websites, and it is really important that you read it carefully, because if you don't follow the instructions to authors and you submit, when they're screening your article and something is missing, they're going to unsubmit it and send it back to you. So you're just delaying the process. Different journals have different submission platforms as well. So you want to take some time to familiarize yourself with the platform, because if you haven't read the instructions to authors, when you get ready to submit on the platform, they're not going to allow you to proceed unless you've uploaded all of the required documents. So it's another way of checking yourself and making sure that you have all of the necessary documents for submission. Generally, you will have to submit a cover letter. So try to write one that is professional, which means that you're actually addressing it to somebody. You're going to say what you're submitting. It should have a few points on your key findings, because you're trying to convince the journal that they should consider your work. And it should also contain a few statements on everyone agreeing to the submission and that your work has not been submitted anywhere else. You could also consider asking external person somebody who's not been involved in your research and your writing up of your manuscript, but who might be in your target audience, ask them to read the manuscript. It's just a way of getting peer review before submitting. And this is one of the benefits of posting on a preprint server, because lots of people might access your article and give you feedback. And that gives you some time to make any changes before your formal submission. Now, the submission, this is the waiting game. When an article is submitted, it's going to be screened first to make sure you have all the requirements. And if all of that is met, then an initial decision is going to be made, which is really either we're going to reject this or we're going to allow it to go to peer review. The reality is that peer review can take a little while. Most journals will say, give everybody like a 2-week period, 2 weeks to accept an invitation to review, 2 weeks to submit your review. So that's a month there already if people take the maximum time. Peer reviewing is voluntary. It is very valuable and useful, as Tina said, but it can take time and you need to be aware of that. But as time goes on, you might be wondering, oh, should I contact the author, the editor? How long do I wait before contacting the editor? It doesn't make sense to contact the editor 2 weeks after submitting because it might still be at that screening stage. Now, some journals have on their website different timelines for when to expect things at different stages. So you can use that as a guide. If they say time from submission to acceptance is 4 months and it's now 5 or 6 months, it's probably reasonable to contact the journal. And when you do contact them, please remember to be respectful. A lot of it is voluntary work. They're not handling only your article, they're handling multiple articles. And so, you still want to be respectful and professional when you are querying what's happening with your manuscript. And of course, you can also track your manuscript on the submission platform. It should give you an idea about what stage your manuscript is in. Then the last stage is really receiving a response, and there are 3 pathways. You can be accepted outright, which would be fantastic, but more often than not, it's either revisions or, unfortunately, a rejection. So we're going to focus on the latter 2. First, dealing with revisions and responding to reviewer comments. This might be a lot of people's least favorite part of the revisions process, because there can be a significant number of comments from the peer reviewers. The minimum number of peer reviewers is 2. Some journals will get 3 if there's a statistical analysis to be done. Some journals get 4 if they want a patient reviewer. So you can get a large volume of information coming back to you, and it can be overwhelming. So you want to take some time to digest that feedback, carefully read the comments, share it with the rest of your team. The burden doesn't lie with you as the lead author or the corresponding author. Share it with everybody. They all have something to contribute. Most times you're going to have to submit a point-by-point response to each of the comments, as well as a manuscript with tracked changes showing where you've made your changes in response to those comments. Oftentimes when we get comments, we might feel a lot of emotions depending on those comments. But always remember to be respectful and professional with your responses. That does not mean you can't disagree. If you don't agree with what a reviewer has said, I think that's fine. It's how you put it across in your response. You have to give a justification for why you don't agree and why you've done what you've done. When you're also writing your responses, you want to make sure that you're providing sufficient detail to address the reviewer's comment or the editor's comment. If they've given you a suggestion, they've told you to do something, or they've asked you for an explanation, don't just put a one-word response with changed or done, because it doesn't tell them anything. And sometimes reviewers will use that point-by-point response alone. They may not go back to the manuscript itself if you have sufficient detail in your response. If they go back to the manuscript, they want to be able to find where you've made that change easily. And in some instances, if you haven't done it, they're going to ask the editor for these documents and for more details from the author. And then as Tina mentioned, she's had an experience with authors having 10 rounds of revisions. So you need to mentally prepare yourself for that as well. It is, a lucky person to get accepted right off the bat after one round of peer review. It's not uncommon to have several rounds of peer review. And from our perspective as authors, it might be frustrating, but just understand that the journal is really trying to help and support you and get you to that acceptance point. Then lastly, we have rejection and how we deal with it. So again, there are two pathways here. You can have what is called a desk reject. This happens in the screening phase. It's quick. It might be within a week or within a month. It's painful. Nobody wants to be rejected, but the desk reject allows you to move on to your next journal fairly quickly. The other rejection can occur after peer review. And unfortunately, this could happen after being months in the peer review process or after multiple rounds of peer review. And that becomes frustrating and emotional for us as authors. So again, you want to take some time, step back from the paper, but come back to it, read the feedback. If it is useful, constructive feedback, use it to revise your paper, because you're going to have to keep going. This is part of the process. You made your list of journals, your top 10 workout. Submit, and just remember that it can take a few attempts, but your work is valuable, it is worth it. And so you should keep going until you find the right home for your research. And that's it. Thank you very much.
Thank you so much, Loren. It was very, very well detailed. I think it's a very important information for people that's publishing for the first time. I'm going to call our last speaker. Dr. Caroline Allen is a social scientist who has worked in the Caribbean on public health issues for most of her career. She has worked both inside and outside academia as a researcher, behavioral scientist, and consultant for agencies including the University of the West Indies, the UK Medical Research Council Social and Public Health Science Unit, and the Pan American Health Organization. She is lead author of the Research for Action Agenda on Climate Change and Health in the Caribbean, the most comprehensive information source on climate change and health in the region. She has 55 peer-reviewed publications in scientific journals and books. So enjoy, Dr. Caroline. Thank you so much for joining us, and over to you.
Thank you very much. Okay, I think I've changed my... Can everybody see that now? Can everybody see my presentation?
Yes, thank you.
All right, so I'm going to be really focusing, I think my colleagues have really done a great job on the practicalities of writing. I'm looking at particularly one of the objectives of this workshop, which is about gaining practical insights into the publishing process. And I'm actually focusing on the Caribbean situation, and I see that we have a global audience here. So I do believe that what I'll be saying will be quite relevant to other audiences, but you can kind of treat it as a case study. So it's called Crossing Boundaries, and what we're going to look at is boundaries to do with geopolitical position of particular authors in particular countries. Size, as you know, the Caribbean is made up of small island developing states, and that can sometimes be quite a boundary to get across. And disciplines, of course, climate and health have different disciplines and need to work together, and also institutional boundaries. So number one, geopolitical position. Okay, so a little bit of theory here. There's a social science set of theories called world systems theory, which is really about different positions in the global political economy. And the core of the global system tends to be the industrialized countries who historically have taken resources from other countries and produced goods and exported them back. So that, in a nutshell, is what the world system theory is about. Now, if we think about how this applies to publishing, actually, one of the things in world system theory is that the core countries tend to have the institutions that produce the publications, the knowledge, and so on, and often the periphery provides the data. The semi-periphery countries would be sort of in between, doing things like processing, providing equipment, etc. So it speaks to some of the issues that Loren was talking about power issues in international publishing. Now, I'm now showing a graphic from a WHO study, which was looking at peer-reviewed original research journal articles on climate change and health by income group and region over basically a 10-year period. And we can see that there's really quite a lot of inequality, with the bulk of publications being in high-income countries, low and middle-income countries being only about a third, and then there were some global research articles as well. And we can see that that actually Asia has the highest number, which is sort of there are global shifts, particularly China is going very much ahead with publications. So there are global shifts from countries formerly thought to be kind of semi-peripheral, but moving ahead now. But let's just focus now on the region where I'm resident and where I'm going to be talking about, Central America and the Caribbean, which is very low level related to others. Now, this, as I say, is from a WHO study, and I've provided the reference here. But this actually it has quite a lot of limitations, this particular review. It looks at peer-reviewed original research articles only, so not things like review articles and opinion pieces and case studies, case reports, etc. It's only articles in English, only 3 databases were searched. It used limited keywords and climate change terms, and it wasn't a systematic review. But nevertheless, I think it does point to some fairly severe inequalities. But we also need to think that there are many other kinds of knowledge that are being shared in these regions, and we need to kind of sometimes respond when we don't think that our contributions have been adequately taken account of. So one of the issues that Loren was talking about was about access to literature. And I wanted to highlight an initiative called Research for Life, which helps developing countries get access to literature. You'll see that there's 4 different sort of aspects of it. There's access to health research, research in agriculture, research in environment, and research for innovation. And the idea is that it's to reduce the knowledge gap between industrialized countries and developing countries by providing access to critical scientific research. So you can, if you're in some of these countries, get free access to those journals, which is very important when you're trying to assess, what the latest thinking on your field and trying to decide on where to publish. So eligibility is for local not-for-profit institutions from 2 lists of countries, areas and territories, based on their gross national income, least developed country status, human development index, and healthy life expectancy. And it's not just universities, it's other sorts of institutions as well, including, for example, non-governmental organizations. But you have to be in an institution, which can sometimes be a challenge. If you're, for example, just a doctor who wants to publish some research, you might need to affiliate yourself with one of these types of organizations. But the other thing is that some of these criteria don't fit. Some vulnerable countries that don't may have higher income per capita, but have other vulnerabilities. So within the Caribbean, which is a very diverse region, only some of the countries have free access, and some of them go into the second group, which pay 1,500 US per year, but that's a lot less than, you know, every person in the country having to pay every time they access, and the institution have to pay for access. So it's still a good discount, but we can see anyone who knows Caribbean knows that that isn't the full list of countries at all. So again, the typical journal policy in terms of access to journals, free access. Sorry, I'm talking now about journal publication fees. As Loren was saying, some of them charge fees. Typically, they charge fees, as does the American Journal of Public Health. They do charge for articles to be open access because they need to make their money from somewhere. And nowadays, it's often from the research team, unfortunately, or for colour images. But if it's a journal for which people have to pay, the authors would not have to pay. But again, the waiving is dependent on where the corresponding author is from. And the corresponding author is usually the first author, who tends to be the person who wrote it, took primary responsibility, or the principal investigator, who tends to be the person in charge of the research, who tends to be the last author. But the criteria, usually you have to be in a lower income or lower middle income countries, which in practical terms means that if you're Caribbean countries tend to qualify. But some agencies, such as Wiley Publishing, is having a new scheme whereby it's based on purchasing power in each country. So there's a wider spread of countries now in the Caribbean who will be eligible for this new scheme, and that's not the only publisher doing this. So there are some attempts to redress some of the institutional balances, the power balances, and equity issues between different parts of the world. Another issue is increasing your impact. So your impact tends to be more widely. Your research tends to be more widely seen if you aim for original research rather than just doing things like reviews, etc. You should look at the journal impact factor. I take on board everything that Loren was saying. What it is the yearly mean number of article citations published in the past 2 years. You can look at the citation reports, Journal Citation Reports website, which covers over 8,000 social science and science journals. It can increase professional opportunities, and especially if you want to traverse, be seen outside your region, it can be quite important. But also consider the speed of publication and the acceptance rate, which tends to be kind of inversely related. So if it's a really high impact journal, they don't have to accept so many, so it could be harder to get into. Do check if your journal is on major bibliographic databases such as PubMed, because if it's not, then your article is not going to be seen by many people. So here is just an example of information provided on the website of that shows this particular journal. The submission to first decision is just 1 week, but their acceptance rate is only 10%. But on the other hand, their journal impact factor is relatively high at 3.1. There are some journals, and as Loren said, you can also consider lower impact journals if it goes to the specific audience you're thinking about, that might be less than one person every 2 years cites this particular journal. So it's a judgment call. Another boundary is the small size of the country. As I'm sure everybody knows, that the Caribbean is mostly small and very small countries. So how do we traverse these boundaries of size? Unfortunately, the size is not one of the things that is considered in schemes to support research in developing countries. We need to lobby for that. And also, at the same time, low levels of national investment in research are a feature of peripheral countries. You saw that schema earlier about world systems theory. The peripheral countries tend to have low levels of national investment by the governments in research. We also need to lobby about that. But that means that, especially that local institutions, NGOs, and universities, etc., are really critical in redressing global publication inequalities. We need to value institutions like the University of the West Indies in the region, in our region here in the Caribbean. Another challenge, though, is that there are few researchers with specialist skills in any particular country. You might have just one statistician in a country. Some very small countries may not even have one. You might need to approach somebody in another country. So the bottom line is that researchers need to actively seek collaborations. So a good example of collaboration is the Lancet Countdown SIDS Center, which is based at the University of the West Indies in Mona. The team hails from the Pacific, Caribbean, Indian Ocean, and Europe, the Americas, Oceania, and Asia. The first report of this collaboration was published last year, and they don't just do research; they also monitor climate and health. They engage in policies. They do outreach and communications. Now, third boundary, disciplines. So we can see that in the Caribbean, actually, there's been quite a loosening of boundaries about what counts as health research. So we can see that historically we had an institution called the Commonwealth Caribbean Medical Research Council, which was established during colonial times. It tended to be highly biomedical. Then it transitioned to Health Research Council, a broader concept of health, and now it's the Caribbean Public Health Agency, which is the host of the annual conference. So that means that there's increasing acceptance of qualitative and social science approaches and ecological approaches, such as shown on the right here, where we look not just at the individual behaviors and biology, but also environmental and social factors and structural factors such as policies and social norms. So we're getting more and more co-authors from different disciplines. And this is really important because we need that for planetary health. So this is a definition from on planetary health, a solutions-oriented transdisciplinary field and social movement focusing on analyzing and addressing impacts of human disruptions on Earth's natural systems and human health and all life on Earth. So it's a transdisciplinary field. We can think, if we want to look at human disruptions to the environment, we need social science. If we need to look at the natural systems, we need meteorology and other physics, etc. Human health, of course, medicine, public health, all life on Earth, biology. So those are just some disciplines that we need in planetary health. Planetary health is an emerging transdisciplinary field. We're bringing together people who haven't always worked with each other before and who basically have different ways of conversing about what they do. So researchers are sometimes challenged to learn about how to speak in the other's languages, their terminology, how they do their science, etc. We do have some transdisciplinary journals. Of course, the one that Tina is heading, Journal of Climate Change and Health, is one important one. But you know, when you want to decide on a journal, read articles from several journals as well as the author guidelines to understand the format, the disciplinary content and style, as Loren was saying. When you're writing for a journal, you need to learn how to speak and write in the journal's language, and that's quantitative as well as the language that it's spoken, the way it's spoken, the formality and things like that. Sometimes rejection by a journal involves it just wasn't a good fit. So it's not always to do with the quality of your science. It just wasn't a fit with what they tend to look at. And sometimes they'll just tell you that. They'll reject it because this isn't the sort of thing that our journal looks at, and they may even make suggestions for other journals you could look at. Now, especially in developing countries, we need to speak to our own people in our own words. So should move beyond comfort zones, just want to speak to the converted. We need to get out there and convert the policymakers and people on the global level. So we need to go beyond disciplines and beyond maybe our own boundaries, institutional ones. Health and climate researchers are usually in different agencies or departments. In Caribbean, health and meteorological data are rarely combined in surveillance systems. That means that researchers often can't get those in the same place at the same time, so it's difficult for them to do their research. So they often have to do their own data collection and analysis. However, there are some examples of collaboration. For example, the Health Climatic Bulletin in the Caribbean brings together the Institute for Meteorology and Hydrology, the Agency for the Caribbean Public Health Agency, and PAHO. And an example of a collaborative project, it brings together several universities and institutions from outside and within the Caribbean. So that's an example. And I'm just going to quickly look at that, though. The co-authors of this particular project are from universities in the USA, several different countries, as well as the Caribbean Public Health Agency, the Institute for Meteorology and Hydrology, Ministries of Health, and the University of the West Indies. But again, the first and last authors on this particular paper are from universities in the USA and Ecuador, and not from the Caribbean, even though it's about the Caribbean. And that's one of the things that that Loren was highlighting. So we do need to pay attention to things like that, and we need capacity building to enable first authorship and for principal investigators to be from developing countries, small and developing states. But also Caribbean people, people from those states can initiate authorship. You don't need to wait on anybody. I hope this webinar will help you to think that you can start out and author. So our takeaway messages. The journey to publication in the Caribbean is challenged by boundaries. But despite many obstacles, Caribbean people have repeatedly shown their global competitiveness. On the right, we're seeing Shelley-Ann Fraser-Pryce, who I hope many of you all around the world will know as a world athletics champion, multiple Olympic medalist. She's known as the pocket rocket. She's small, but she's powerful. In writing for publication, Caribbean people can draw on a history of building alliances and transcending limitations. And in climate change and health publishing, we are really at the beginning of an extremely critical journey. Thank you. And I've put up how you can register on our community of practice for climate change and health in the Caribbean. And I think that's also been put up in the chat, so I'd encourage you to join.
Thank you so much. Thank you so much, Caroline, for bringing all these boundaries regarding to the Caribbean region. I would like to invite all the speakers to turn on your camera so we can go through the Q&A sessions. I have a very simple question that you can respond to the audience, and very important. What is the difference between the first author and the last author? What does it mean being a first author and a last author? Maybe Tina can respond to this.
Sure. Typically, the first author is the person who takes the lead in organizing and, distributing the tasks among the paper. Often, the first author is the corresponding author. The last author or senior author is usually the more senior person on the team that has already published plenty of papers and is trying to mentor the first author in publishing. So it's kind of a badge of honor to get your first authored paper, and your mentor gets the badge of honor of helping you do that. So I think that's the usual distribution.
Yeah, that's very important because maybe you think that, oh, I'm going to put this person as a last author, but the last author also have a very important position in the paper. Regarding to authorship as well. So in the past, having a lot of author was not well seen, but now these things are changing. And so I'd like to listen from you, maybe Tina also as a chief editor, how these things changes and how people can better collaborate now with another people in a different countries to publish a paper and be very well received in and not, okay, this paper has a lot of authors and it's not really good. And so how people are seeing this today.
Yeah, I can take that one and then see what my colleagues say. To me, it depends on what the topic of the paper is. So I've been on papers with literally dozens of authors when it is, for example, a multi-site collaborative effort where everybody gathers data. There's no way to make those have only a few authors. Where multiple authors are frowned upon is, for example, a single laboratory where, it's a new scientific discovery and it should have only taken a few people because it came out of one site. In climate change and health, it's so often, as both Loren and Caroline pointed out, it's so often by nature interdisciplinary. And it's a wonderful way to collaborate across geographies. As my colleagues pointed out, for countries where publication has so many barriers and so many hurdles, there is absolutely no reason that it would sort of ding your option of publication to team up with people that are more experienced, but let someone who's really passionate about the particular topic being discussed be first author and get that experience.
Anybody who wants to add to this?
Yeah, I think those more experienced researchers, should really be mentoring the ones who want to give it a go and want to try. That doesn't mean you gift authorship. Gift authorship is also the opposite issue. Sometimes people expect to be first author when they haven't necessarily done the work, which is why it's also important to take account of those International Journal of Medical Authors criteria that Loren was talking about. So, but I think it's really important for experienced authors to kind of pass the baton. And quite often, if they're still concerned about their publication record, if they're the principal investigator, they can be the last author. But I think, especially to give people on the team, especially maybe in developing country settings, a chance is very, very important.
And sometimes it's also a very good opportunity to invite people that has a skills that you don't have. Maybe you have like a very good study design and you collect amazing data, but you don't know how to analyze or how to interpret it. So you can also invite another authors that can collaborate and make your publication able to be published. I have a lot of questions to Loren regarding the preprint. If you use a preprint server, will that count when they ask, have you published your manuscript anywhere before?
Yeah, so a common question, and most journals will actually have it on their website because the preprint servers are so common now. That does not count as a publication. So it's about reading the instructions for authors on the website to see what their guidance is. And so in your cover letter, you'll state, well, this has been published on a preprint server. You put the link so they know, because it is going to be picked up when they run it through the plagiarism software. If there isn't anything on the journal's website, I would say contact the editor and just ask them. I'm sure Tina can give your thoughts on that as well with your journal. But I know a lot of journals have information on the preprint servers.
Yeah, maybe we can also talk more about this. That if you are going to publish a paper, they ask you to not be published anywhere else before, but maybe you kind of divide your paper and you have some kind of data in one paper, and so how people can do this and what are the rules in publication.
I think you're talking about salami slicing. It sounds like we might be talking about that. I'm not sure if it is that or not, because there is a fine line
Yeah,
between, yeah, splitting up your work to get multiple publications when it could be
yeah,
published in one setting versus doing a really big project that is deserving of multiple publications. And again, anything where there's going to be significant replication or duplication of information, it may not be justifiable to publish as multiple papers. So this is something that, and there is existing guidance on it, so authors and researchers can look this up themselves to try to figure out whether the work that they have done deserves multiple publications or whether it can be presented in one paper. But let's say you think, yes, I deserve multiple publications from this, and you submit it to a journal, and the journal editors read it, they might think differently and then go through their flow charts to follow with respect to redundant publications, and they might ask questions to try to figure out what's happening and should you really have multiple papers, or should this have been in one paper?
Yeah, what I would say about that is that a lot of times the editors and even the reviewers have opinions, as Loren said, and they may advise the author this should be two papers if it's too much for one. They'll put that in their review. Remember that what the journal wants is for good work to be published. So they, depending on the journal, there are some journals that, like a competitive university, they can reject almost everybody. But there are a lot of journals that are committed to, it's all volunteer labor. I mean, on my journal, the reviewers do it for free. The editors do it for free. We do this because we believe the topic is important. And one of our basic principles, I'm not trying to advertise my journal in particular, but I don't think it's the only one. We think it's important and we want your voice to be heard. And so we want your paper to be the best it can be. So oftentimes this issue of, have you published before in an abstract? Did you present this in a meeting? Just be transparent about it in your letter to the editor. Just say the truth. Always, the truth is the best thing, always. And if you just express and explain, they'll work with you to try to make it the best it can be. And if it's already been published, they're not going to publish it because they'll be in trouble for that. So they'll work with you, is my advice.
that's a good advice. Caroline, maybe you can tell us about when it's best to publish, like in a locally journal, maybe in your language, and when it's important to publish in an international journal.
Okay. Well, I think they're different. I think what Loren was saying is very pertinent. It's really about the audience you want to reach, and sometimes a very much a regional journal would tend to have a low impact factor because it's just, well, in our small region we have small populations, small academic populations. But if that's who you want to reach, and it's something that's very, very specific, that's quite specific to your region, that might be the best. That might be the best place. And also, the rejection rate tends to be lower. So I think you have to balance up all these different things to get into the global literature is quite challenging, and you really need to think about the acceptance rate. You saw the one that I showed, which was only 10% of the papers eventually get accepted. So all of that, you really need to weigh that up. But it's quite important. If you want to be really part of an international team, they're going to look at the impact factors of the journals that you have published in. And I think it's about time that we see lots more people from developing country settings publishing in the high impact journals and being first or last authors. So there's no clear answer to this. It really depends on what you're trying to achieve.
Yeah, and also sometimes when you maybe your paper is not novel for the global point of view, but maybe it's a novel in your region. It's something that you find out or apply the same methodology to your region, and you find very good results. So maybe on this situation, it's good to have a local publication. Another question is regarding to emergency situations. What suggestion does the panel have for research in emergency situations where you don't have time to get ethical approval while the results you are reporting are useful and important to share? I think we have a good example during the pandemic. Maybe, I don't know who wants to share.
I think it may not be possible to get into a peer-reviewed journal unless you have the ethics approval. It's very unlikely. But there are kind of reports that you can, there are post-disaster reports that can be shared with colleagues, things like that. And some of the UN agencies, for example, do publish things like that. But in terms of peer-reviewed journal articles, it's still very important. One of the things that it happens in emergencies as well is that quite often your research equipment might be devastated, your paper records might be devastated. There's other issues as well that arise in emergency. Perhaps my colleagues would like to respond as well to that one.
Well, I would say that ethical approval doesn't mean that every patient whose records you use needs to give consent for you to do research on their medical records. You simply need to go through a process where you do need an institutional mechanism to get ethical approval. But for example, there's a fair amount of exemption for things that are about quality control. There's exempt ethical consent approvals for things that are totally de-identified and you're just looking at medical records. So there are many contexts, even in disasters, where you're looking retrospectively or you're looking descriptively in real time and you're describing things, but there's nothing about the description that puts anyone's privacy or protected health information at risk of being disclosed. So you simply need a body that can work with you and inform you about what constraints there will be on the data that you're going to that you plan to or would like to report. So it's not as though every health-related study requires complete informed consent from every bit of patient data that's used. So there are lots of ways to do studies that don't require patient consent.
Yeah, I think we need to distinguish between primary and primary research and secondary research. So I think what Tina's talking about is use of data that's already there, which is actually very important. There was important research after the current hurricanes in 2017 that looked at death rates following the hurricane as compared with the previous year, and were really important in highlighting how much deaths had been affected several months after the hurricanes, and that was using existing records. So that's secondary research, but it might be different to collecting data with individuals of different categories.
There is also a very interesting question, and that's going to be the last one, regarding to AI tools. What are the appropriate limitations and wise uses of AI tools in writing and peer review processes? Some journals usually explicitly state their policies, but many still do not. So what are your opinion about use of AI.
Loren, that would be a good one for you.
Thank you. Yeah, it's exactly what the person has said. Journals are now coming out with guidance on it. I know the World Association of Medical Editors has also produced guidance on it and when it's acceptable and when it's not. And I think this is still a tricky area. So there's no yes or no answer as yet. The journals that I'm familiar with or I work with ask you to acknowledge it. And it's really the extent to which you have used AI. If you just use AI for grammar because English is not your first language, or whatever the language of the journal is, it's not your first language, then it's generally acceptable. If you've used AI to write the manuscript for you, then some of us will still consider that plagiarism. And then on the other side, with peer review, this I am less familiar with the peer review aspect of it, although I have seen I've never come across it myself in my experience, but I've seen other people post about it where the reviewer has posted the AI generated review and they've left the part at the top where the AI tells you, here's your response. So the editors knew it was an AI generated review. And it's something to think about. For me personally, I wouldn't appreciate that because I might as well ask AI to review the article for me rather than asking the actual experts in the field. But it's still something that is ongoing as we develop guidelines related to it.
Okay, I will stop the session here. Thank you so much, all of you, for all the information. I think it was very helpful, and I encourage all the audience to start writing your paper and try to publish it. I have a last poll questions, and I would like to invite you to take it before we finish. Would you be interested in participating in a writing publishing workshop? Yeah, 100%. Okay, so yeah, 100% wants to participate in our. So thank you so much. Let me share my screen here. So, as I said before, this is our last session, but if you want to receive more information about opportunities for the Caribbean and some other webinars that we may have in this break, so please join our WhatsApp group. And if you want to have a CME, the link is in the chat. Thank you so much. See you soon.
Thank you.
Thank you. Bye-bye.
Great.
Danielle, you could just give them 1 more minute to capture the link, please.